Sweet. Okay, so thinking about the soft tissues around the trochanter. So you find a hip that's given you trouble or that you think has some restriction in it, and then you need to go forward and try to figure out where in the region of that hip things are happening. So you have to have a way to get through that soft tissue. Seated obviously is a challenge because the vast majority of that tissue is not appropriately exposed and it's in essentially shortened and obscure positions. So inappropriate to do it there. Lay on your back for a moment. Okay, so when you're thinking about the hip in supine, obviously if I think about that trochanter as a horseshoe, a decent amount of this is somewhat obscure to me. With a straight leg, what do you suspect is going to happen to the tissue on the front? What is that tissue more likely to feel like? On tension, firm, lengthened, lots of terms. It's going to be firmer. So if I just take a general grip like this, like I think about a horseshoe and I make a horseshoe grip, this is actually where you would do some degree of push-pull, right? So you can't see it, but it would just basically be like this. Right now, if I do this, everybody sees that I'm not checking that tissue. I'm not checking that tissue. I'm using it as a handle to wiggler, right? Now I'm checking that tissue. Am I pushing very firm down here? No, it's like it's just there, right? So one of the challenges with that is that on the thumb side, it's very pointed, right? So the amount of information I can gather from the tissue is smaller. And also for the patient, it would be less likely to be comfortable. Now, if I simply have her bend her knee, now this gets a little bit shortened, relatively speaking, and the stuff on the back doesn't really get tightened because I would need to do that. So I'm in a relative position where it works a little bit better. I stabilize this and I do this, right? And it's there-ish, right? So it's on the thumb side. So even though I say on the thumb, it can be more pointed. If I was like this, it's pointed. If I'm like this, then I can get information farther and I can be broadly across more tissues. Hopefully that makes some sense, even though to the room it's somewhat obscure. That's why we do the video so that you can see it. Lay facing that way. Thank you. Now in lateral, again, working behind the patient ends up doing a lot because they're closer to you. You don't have to reach as far. They're more on the table. So the stability of the patient is increased as much as possible, as opposed to if I'm in front of them and I have to bring them towards me. Also, my ability to control this area is improved. Now, if I'm trying to check that soft tissue in this position, if the leg is still, just laying there, what do I expect to feel here compared to in other positions? Do I expect this to be soft or do I expect it to be a little bit more tight? A little bit more tight, right? Now, I can still stabilize. Now, so if I just did it this way, right? If I just squish into it this way, do I get as much of a sense as I could get, or am I pushing her away and blunting my sense of what's happening with that tissue? So relational motion, one thing needs to stay still, one thing needs to move. So I need a still pelvis and a still femur, right? Because I'm looking at the tissues that span between them. So here, there. Just yield to pressure, so just pushing in. Now it's relatively speaking perpendicular to fiber direction, even though I'm not doing a push-pull here. So just here, here, so I'm going around the top. Now if I need to go the other way, right, if I want to check the tissues lower, just right there. So again, stabilizing the femur, stabilizing the pelvis, just go to the trochanter, push on it, and I'm just going to push in. That's all I'm going to do. All right, now, many of you, as a solution to the challenge that we gave you with try to check these tissues, so still bone moving muscle, many of you started doing this. This is not what we're looking for, at least to figure out what is going on with those tissues. Now, the rationale is that the more moving parts that I have, the more information I'm taking in, the harder it is for me to figure out what's going on with these tissues. I can figure out what's going on with the movement, but it's harder to figure out what's going on with the tissues. If you want to put these tissues into a slightly shortened position so it's easier to check, you just stay still here, and then you do this. Now, the challenge that I have is, again, if I'm not paying attention to how I'm pushing, I can move the patient, even if it's small, right? So I have to be much more careful with how I would do it here. So even though the trade-off in lateral is that the tissue is going to be more tight, I can still get it. Because really, I expect it to be tighter, especially here. And then I'm just going to move around. I'm going to look for the area that has a little bit more tension with respect to assessment. With respect to a treatment, an integrated approach where I'm using the leg as a lever is completely fine. Like it's okay. But if I'm just trying to isolate and test the tissue, it's better if the leg is still, just resting. I'm not having to figure out what's going on between these things. Because if you're in motion, although you're paying attention to this hand, you're still feeling all the other stuff. Right? So it does mess with your ability to figure out what the heck is going on if you're trying to be clear. If you just like everything in wiggly motion, whatever. But your ability to be clear about it is lower. We'll have you on your stomach. Okay. Now, for prone, the tissue that's going to be somewhat more obscure is on the anterior side of the hip. So there is a trade-off here, but this tissue, the tissue around the trochanter is most exposed, most visible, most free to move in the planar plane is required here. I want to preferably work on my side. You can work on the other side, right? You can, but that means that you are now mechanically disadvantaged because you have to reach and lean. The problem that will always sneak up is that you push your thighs into the table so you don't fall over, and then your hamstrings have to grab, and often your feet have to grab, depending on the surface that you're on, because you will start to slide. So you really have to lock those hamstrings up when you work cross table. So you find the trochanter generally. So if you're trying to find something that's quite prominent, a bone that's quite prominent, you just should go into the general region, and you have a very broad hand, right? So in this case, I tend to use my fist. So I use my eyes, I see the gluteal region, I see the pelvic region. I know that the trochanter is on the side, so my hand's big enough that it's going to span. So I just go there. I find the trochanter. Now I'm going to check the tissue. There's just a lean on, right? So yield to pressure here, go a little bit further forward, yield to pressure there, go a little bit further forward, something there. Yeah, okay, right? Because the reason I would ask, as far as when I say something there, it's like you feel something that's uncomfortable, is what I'm using that to try to figure out. As I push in, the yield is very different, right? It's immediately like that is not the same, therefore I think there's something that the patient may feel as a sensation. I don't know it for sure, I'd have to ask for confirmation. But if I tell them, that hurts, doesn't it? Then I can look like a dummy, right? So going around the front here, now I find the trochanter again, and I can check those tissues, right? Not too bad there, but no. There? Yeah, okay. It's a little bit more obscure in that case because it's not as much of an obvious difference. As opposed to, thank you. Don't be. I said thank you, partially to make fun of you. No, I couldn't do it. I was almost going to be able to let my hand off and her keep her leg there. Now, I can still do this, but hand posture becomes a little bit tougher because I've now made it harder for me to move around by holding that. Right? So it's going to be a little bit harder for me to figure out what's going on, and I'm going to be exceptionally tempted to do this to figure out what's going on. Now, I'm not figuring out what's going on with the tissue as much here. I'm figuring out what's happening between all of these things and how they're playing together, right? If I want to know which tissue is probably most responsible, I want it to be as reductionist and isolated as possible. I'm not going to make assumption about which muscle or muscles it is. I'm going to figure out where there is a lack of yield to the pressure that I impart, either pushing and pulling or just squishing, right? But this limits my ability to get into better postures depending on the length of my arm and the length of their leg. So this gives me more of an advantage in figuring it out. It's not that I can't figure it out this way. It's just more mixed messaging for me to try to figure it out, and I'd rather avoid that.